Welcome to this informational video about the upcoming tender for the Catalan Institute of Oncology, which consists in the procurement of a service for the control of antimicrobial resistant microorganisms. In this presentation, we will provide an overview of the specific service required and key details for potential bidders. The Catalan Institute of Oncology is a public non-profit center working almost exclusively in the field of cancer. With a comprehensive approach, ICO is structured in the form of a network, and it is made up of 4 centers. The innovative solution will be first integrated into ICO Hospitalet, the center that serves the greatest number of patients. The purchase budget for this tender is €825,000. ICO patients are oncomatological patients who are often immunocompromised. Speed is therefore essential for the correct management and prognosis of patients. Furthermore, these are patients who are often prescribed antimicrobials and are highly medicalized, leading to a higher incidence of AMR in this type of setting. The ICO's procurement in this tender is divided into 3 lots, collectively enabling integrated management of antimicrobial resistance. These include 1 lot for screening, another for bacteremias management, and a third for an IT system. The 2 detection systems will be located at ICO Microbiology Reference Service at the Belvite University Hospital, and the information system will have to be functional in both the hospital and the microbiology lab. Regarding the Lot 1, rapid detection of bacteremia or sepsis. The rapid management of bacteremia ensures swift care for at-risk patients, enabling prompt and targeted treatment of the infection. This approach can significantly improve patient outcomes, which is essential given the vulnerability of this patient population. The tests will be conducted in the event of symptoms or suspicion of infection according to clinical criteria, prioritizing some specific vulnerable situations. The detailed requirements are at the tender documents, but in summary, this technique should be from direct blood, and the time from the start of the technique to the result will be less than 6 hours. The technique will be simple, and the test results will be easy to interpret and should be integrated with the rest of information systems in the hospital. It will have the capacity to detect a wide range of clinically relevant microorganisms and key antimicrobial resistant mechanisms. Regarding the Lot 2, rapid detection in screening for colonization or infection by antimicrobial resistant microorganisms. The screening will be conducted upon the patient's admission to the hospital based on specific criteria. Patients with colonization or previous infections by multi-resistant microorganisms who already have an informated computer alert, or in the entry to the hospital from a center with potential risk. This screening will avoid the spread and dissemination of resistant microorganisms, and this approach enables the implementation of targeted preventive measures, enhancing the hospital capacity to manage and control these microorganisms. Additionally, in cases with negative results, it allows for the discontinuation of unnecessary preventive measures, thereby reducing costs. In summary, the main requirements in the standard documents for this Lot 2 are: the time from the start of the technique to the result will be less than 90 minutes. It will be performed from a direct sample, at least from rectal and nasal swab. It will be able to detect a range of antimicrobial resistant mechanisms, and the technique will be simple. The test results will be easy to interpret and integrate with the other systems in the hospital. Regarding the Lot 3, the IT solution for the management and control of antimicrobial resistance, the system must be capable of carrying out the following points: view key patient information or relevant information such as about previous diagnosis, treatments, or antibiotics consumption, will allow easy access and viewing of digital guides, protocol, and guidelines, will allow real-time communication, will allow monitoring of cases and patients and the assignment of tasks between professionals, and will facilitate support and communication between healthcare professionals. They allow to visualize the history of local contaminations, colonization, and infections. The RaDAR system then will combine rapid detection and information management to enhance prevention measures, improve communication, strengthen stewardship programs, and enable closer patient monitoring, ultimately improving antimicrobial resistant control and patient outcomes. All documents and details of this procedure can be found on the Public Procurement Services platform of Catalonia and also in RaDAR website. In both, you will also find a practical guide for SMEs. Thank you very much.